state leader said it won't go away, and it isn't. Moving forward on Medicaid expansion was one of the main topics at an annual health care conference today, and Chief Political Correspondent Glen Mills moderated the panel discussion. He joins us now with a look at where we go from here.
State leaders have made efforts to expand Medicaid in Utah, but so far it's a no-go. Today we talked about what it will take to get the governor, Senate, and House all on board. More than 50,000 Utahns fall into the Medicaid coverage gap, and most of them have no option for health insurance.
The problem is not going away. The problem is real, and we are not only losing hundreds of millions of dollars every year, but we're losing patient lives in the process.
State Senator Brian Shiwazawa and Speaker of the House Greg Hughes were part of a panel discussion at the annual Utah Health Policy Project conference. They talked about crossing the finish line after a handful of failed plans to cover the gap in Utah.
I can tell you, though, that we're open to all options. I know there's a political will to help the most vulnerable, and we need to get to that spot.
The sticking point is money. Hughes says the state doesn't have the luxury of deficit spending to pay for it.
That's where it was difficult for us to agree to a model where we were not confident that the funding would arrive or that we could afford the portion that the state would obligate itself for.
Senator Shiwazawa says there are responsible ways of meeting those concerns.
Through the money that will be generated from the Medicaid expansion itself, from hospital contributions that will defray that cost and in fact even show a positive balance for the state of Utah.
So what will bring the two sides together? Hughes says to get approval from the House, a plan will need to include partners who are committed to sharing the cost.
And it may not even be as robust as advertised by the federal government, but one that we know that we can deliver and provide for those that are truly in need.
The latest proposal, Utah Access Plus, did shift some of the cost to hospitals, doctors, and other providers. It failed, but Hughes says he still wants to try to work out some type of partnership with them. In the newsroom, Glen Mills, Good for Utah.
The debate will continue when the general session begins next month. The first day is January 25th.